Okay guys, this is a continuation of the congenital glaucoma. Before we start congenital glaucoma, I want you to see this diagram. This is the cornea, okay, and this is the iris. We have the ciliary body, okay, we have the convex lens like this, and we have the zonules, okay, which is suspending the lens. Now this is the angle. This part is the angle where the aqueous humor comes from the ciliary body, comes from the pupil, and then slowly comes out from the trabecular meshwork. In congenital glaucoma, the problem is that there is a membrane formation in here, okay, over here. This membrane is known as Barkan's membrane. So this membrane will stop this angle, and the aqueous humor cannot go out. So that's why the intraocular pressure will go up. Right. So now why this Barkan's membrane will be produced is due to congenital anomaly. Okay. This is due to congenital anomaly, and the risk factor is that if you marry to your first cousin or second cousin, you know, the near cousin marriage or blood relation marriage, the risks are increased. This is autosomal recessive. Studies have shown that if you are marrying to your first cousin or very near to your blood relationship, okay, so there is 3 times increased chance of autosomal recessive disorders. So please do not do that, okay. That's a tip or advice you can take. So that's why you can see the congenital glaucoma in India and like some developing countries or some any other countries where they are practicing marriage in near relation, okay. So that is what is happening. That is the reason we're having a Barkan's membrane. So now we know that we are having this membrane. So now what to do? How do you understand? Diagnosis of this is very easy. There are 3 symptoms only, okay. You should remember this straight. There will be lacrimation, okay, there will be photophobia, and there will be blepharospasm. Spasm means shut, blepharo means eyelid. Photophobia means they will be irritated to see any kind of light, maybe some sunlight, maybe any your LED lights, or lacrimation means lot of fluid coming out. Remember, till 1 week of age of birth, okay, from birth to 1 week, there will be no lacrimation. It is pathological to have any kind of lacrimation, okay, because the tear glands are not being produced only till 1 week of age. So there will be lacrimation, photophobia, and blepharospasm, okay. Along with this, if we examine the eye will be very big, okay. It will be a very big eye, okay. You can somewhat say it's like a bullseye, okay. And there will be corneal edema. How will you know it's cornea? Because cornea is the most transparent layer of part of the body, and if you shine a light, you won't be able to see the iris clearly. The details will be gone, or you might not be able to see the iris 100% only. So why there will be corneal edema? Because you should understand, there are 5 layers of cornea, okay. So what happens is that the endothelium of the cornea is having some sort of pumps, okay. These pumps are responsible for pumping out the aqueous humor. Aqueous humor is normally always trying to go and enter to the cornea, but the pumps which are present on the endothelium of the cornea is pumping out. But in this congenital glaucoma, the intraocular pressure is so much that this pump actually fails to pump out. So obviously there is accumulation of fluid, and this cornea becomes hazy. That's the reason why the cornea becomes hazy, okay. So now as the cornea becomes hazy, and this is taking in a lot of fluids and all that, so actually sometimes you can see a tear in the cornea, okay. Cornea is also having a layer that's known as descement membrane. That descement membrane actually ruptures, okay. If you rupture, you can see that under under the slit lamp, or even sometimes direct observation also, you might be able to see it. You will be seeing striations. This is how Haabs triad looks like. Can you see this? This is the line. This is the line. This is the cornea. Okay, this is the line. Okay, so it is a bit difficult to appreciate, but you can just check it out. This is the lines. Okay, these are the rupture that you are able to see because of the descement membrane has been getting ruptured. So now you know that this is a problem. And remember, these are the three very clinical, not clinical, it's like a triad. Okay, so what is the treatment? Treatment is, there is no medical treatment, it's only surgical. Whenever you write treatment, always write treatment either medical, surgical. So this is how you write it, it looks better. Okay, so there is no role of medical treatment. We are doing a surgical treatment here. Okay, the surgical treatment is here where you might be doing goniotomy. So what is goniotomy? You can see this angle has been blocked by this Barkhan's membrane. No, if you take a needle or something, if you can rupture, puncture this, we can obviously make all the stuff can be resolved, right? But the thing is that it is very difficult because this cornea itself is very hazy because of this thing. Okay, so that is the reason we are not able to see the cornea. Then how can we expect to see the angle? We cannot use gonioscope and see it. It's not clear. So goniotomy is good option, but we are not able to do it because the cornea is hazy. So the next technique is that we can use another technique known as trabeculotomy. Give more attention to the spelling. Okay, the spelling is very, very important. So what does it means that we are opening up the trabecular meshwork. The trabecular meshwork is somewhat like you are opening meshwork. Okay, we're opening the trabecular meshwork. Okay, so this is now new advances are coming in. Okay, the new advances are coming in. We use another technique, but this, why are we able to do trabeculotomy? Because we are not going from the cornea, we are actually going from the sclera. Okay, and sclera is obviously visible, so we don't have to go from the angle, right? There's another technique which is known as trab plus trab. Yes, this means trabeculotomy with ectomy. Okay, so what this ectomy means, we are removing the trabecular meshwork. Okay, and we are opening up this means opening up. So these are the main best technique nowadays is been used is trab plus trab. Okay, we are opening at the trabecular meshwork, and also if we require, we are removing the trabecular meshwork at the same eye. Okay, this is what the best technique is. Okay, so once this is done, so how do you know that what treatment should be used? If the cornea is clear, okay, if the cornea is clear, still it can be, yes, cornea can be clear in congenital glaucoma, yes. If the cornea is clear, obviously no problem, we'll go for goniotomy. Okay, if the cornea is not clear, we'll go for not clear cornea, we'll go for trab plus trab or trabeculotomy. Trabeculotomy, oh my god, see, you sometimes tend to mispronounce the word. So this was about congenital glaucoma. Congenital glaucoma is common in some countries because of marriage in the cousins. So please try to avoid it and spread the awareness because of the risk of the autosomal recessive. 3 times the risk increases of autosomal recessive disorders. So diagnosis is fairly very common, easy. There will be lacrimation, photophobia, and blepharospasm. Along with this, if we do the examination, the eye will be very big. Okay, the eye will be very big, and there will be corneal edema. Why the eye is big? Because you see, we say congenital glaucoma from date of birth till 3 years, because till 3 years the eyeball is very flexible, and even if the intraocular pressure is increasing, no, due to this membrane, aqueous humor is not able to go out, still the eye is able to compensate because it's very flexible. That is the reason the eyeball actually increases in size. That is the reason we say it is a bullseye, as big as the size of a bull or a cow, anything. Okay, and there will be corneal edema. Why? Every time the aqueous humor tries to come to the cornea has one layer that is known as endothelium. Endothelium contains a cell which is known as endothelial pump. Okay, this is containing some kind of pump that is actually throwing out the aqueous humor. Okay, this pumps are known as aqueous pump. Okay, so this is always happening naturally, but in intraocular pressure is so high in a congenital glaucoma, this aqueous pump is failing. That is the reason the aqueous humor starts to get accumulated here. Slowly, when we grow older, when our age grows, this endothelial pump slowly they reduce in number. So you see a small baby, a small child, the cornea will be very shiny. Whenever you shine a light, it will be like reflecting just like a mirror. Whereas you see an old person, you will see the corneal reflection is reducing. That is the reason, because the number of pumps are reducing. Okay, so treatment is you need to do goniotomy if the cornea is clear, but most of the time or many times you're not able to see the cornea because cornea itself is not clear. So you can't see the cornea, then how do you expect to see the angle, how would you see the Barkhan's membrane? So this is gone. Then we have a best technique in strapless strap. We are actually removing the trabecular meshwork also, and we also, if required, we're making some hole also. Okay, so that was about congenital glaucoma, and now we shall go to the more important topics. Obviously glaucoma itself is very important. Now we shall go to adult glaucoma. Thank you.